Okay. Hello, and welcome to the State of Ohio Burn Mass Disaster Modules. The modules are a collaborative effort from burn centers around Ohio. In this module, I will be covering skin anatomy, burn depth classification, and types of burn injuries. My name is Mary Mondozzi. I'm a registered nurse and the education coordinator from Akron Children's Hospital. The objectives we're going to cover in this module are to identify the functions of the skin, differentiate the various degrees of burn injury, and identify different types of burn injuries. When you talk about a burn injury, it's classified by depth, extent, and type of injury. Looking at treatment depends upon the assessment of the burn depth, which is the degree, and extent, or percentage of the injury. The skin, as the body's largest organ, is very complex. When examining the skin, there are quite a few functions of the skin. Its main function is a barrier against the environment. It helps protect us from infection, and then it also provides sensory information, and that helps protect us from injury. It prevents fluid loss by evaporation, and then it plays a big role in thermal regulation. When we talk about thermal regulation, think of your skin as a blanket. In the summertime, it's hot outside, so we sweat, so we cool off our core body temperature. In the wintertime, what happens, it's cold outside, so we will shiver. When we shiver, we generate body heat. Our skin as that blanket maintains that body heat or that temperature. With little children, anywhere up to 6 months of age, they do not have the ability to shiver, so that can cause some problems, especially when they have a large burn. And children anywhere from 6 months to 2 years of age, they can shiver, but they're more fat than muscle mass, so when they shiver, they do not generate enough heat. And then finally, the skin provides us with our identity. Looking at the skin anatomy, it's mainly comprised of 2 layers. There are numerous appendages such as hair follicles, nerve endings, and sweat glands. There's a huge capillary network that provides nutrient flow while controlling temperature. When the skin barrier is disrupted, for example, with a burn injury, it causes direct problems for the entire body. Looking at the 2 layers of skin, we have the epidermal layer. That's our outermost protective layer, which provides those barrier functions. It's very thin, and it's comprised of corneified epithelial cells, kind of like dead skin cells. It sheds itself every 2 to 3 days or so. So those cells are continually being refreshed. With our dermal area, or dermis, that's our true skin, it provides strength and elasticity. It's 10 times thicker than the epidermis. It's comprised of fibrous connective tissue, which contains collagen and elastin. And it also has a blood flow and houses those appendages. When we think of the severity of the burn injury, it depends on the destruction of those layers of the skin. Many factors can influence that depth of injury. First of all, there's the thickness of the skin. We look at the age of the victim. Are they an older person or a younger child? Their skin is a lot thinner than the adult person. We also look at the area of body injured also. The skin is much thicker on the hands and the soles of the feet than on the eyelid areas. We also look at the source of injury, their duration of contact, and the blood supply to that area. Physiological impact depends on the depth and extent of injury. When we talk about the severity of burn injury, initially that's often difficult to assess. The burn wound's going to declare itself within the first 24 to 48 or 72 hours. So initially, some burns can look a lot of a lesser degree than they were thought of initially, or they can be a lot deeper later on. Depending on the depth of injury, burns are classified into categories, and this classification includes terms as first, second, or third degree. These are also called superficial, partial thickness, or full thickness burns. and the depth of injury does guide our treatment. So looking at the degrees of injuries, first-degree burns are also called superficial burns. They involved only the epidermal layer. When you look at that injury, you have minimal tissue damage. The area is going to look dry. There's no blisters at all. Once you have blisters, you're describing a second-degree burn. Many times, the first-degree burn has a lot of redness, and there is some mild swelling to that area. With first-degree burns, the area is going to blanch with pressure. So what that means, if you take your thumb and press down on the area, it's going to turn white. When you release the thumb, it's going to turn back to the pink color. First-degree burns are very painful because your nerve endings are irritated. These usually will heal without scarring in mainly about 3 to 5 or 7 days. When you're talking about calculation for fluids, you do not include first-degree burns in that calculation, total body surface area, or TBSA. Second-degree burns are partial thickness burns. Those involve both the epidermis and portions of that dermal area. Second-degree burns appear what we call moist, wet, or weepy. They have a lot of blisters. Those blisters break open, and that's where you do get that wetness to the area. They're characterized by wet redness, swelling, and of course that blister formation. With second-degree burns, they're very, very painful because now your nerve endings are exposed. Oftentimes, other structures such as the sweat glands or hair follicles, they're involved, but those structures do remain intact. You can have quite a bit of swelling or edema and decreased blood flow in the tissue area, and that can convert a second-degree burn injury to a full-thickness burn. With second-degree burns, what we do is we will subclassify them as superficial second-degree and deep second-degree. What that means is superficial second-degree can take up to 2 to 3 weeks to heal. Deep second-degree burns take longer than 3 weeks to heal, and oftentimes those involve more scarring. And then third-degree burns or full-thickness burns, they involve that entire epidermal and dermal layers. You're going to see the areas dry, tight, and leathery looking. You can have a charred or translucent white or a marbled color to that area. There's quite a bit of swelling, and the area is what we call insensate, which means there is no pain, but because of that tightness and injury. But our patients do complain about pain from the surrounding areas of that burn injury that are of a lesser degree. Maybe the edges of a third-degree burn are a second degree, and so that patient is having pain from that area. With third-degree burns, you can see some coagulated vessels, and that does mean that the area is very deep. There is no capillary refill for a third-degree burn, and there's complete destruction of the tissues and structures, such as those hair follicles, sweat glands, and nerve endings. Now, the nerve endings will regenerate. When they do come back, the person has a little bit more sensation to touch or feel, or hot or cold. With a person that has a third-degree burn, they will never grow hair where they've had a third-degree burn, and they will never sweat because those two appendages do not grow back. This is a chart before you for a differential diagnosis of the burn depth. As you can see, we're comparing partial thickness burns to full thickness burns. They can use 4 comparisons: sensation. With partial thickness, you have normal increased sensitivity to pain, whereas full thickness, they're anesthetic to pain and temperature. With the blisters, very large blisters, or those blisters will refill and get increase in size with partial thickness burns, whereas with full thickness burns, very rarely do you have any blisters. If you do have those, they will not increase in size. The color differences with partial thickness burns, they're red, they're going to blanch with pressure and refill. With your full thickness burns, they can be white, brown, black, or charred. If they are red, The redness will not blanch with pressure. And then the texture, partial thickness burns are normal or firm, whereas full thickness burns are firm or leathery. And then there's a 4th degree burn. It's considered a full thickness burn. What this does, it goes down into where the fat, muscle, or bone is and destroys those areas. Many electrical injuries fit into this classification. You can see tendons, muscles, and bones at times. And at most times, damage can exceed the ability to repair the area where they may need to have that foot, leg, hand, or so amputated. Now, there are some special wound terms when we talk about burns. One of the wound terms is eschar. Eschar is a term that describes dead skin cells. Now, you can see this on initial presentation, like you see on that foot, where we're going to describe that injury as there's some black, dry eschar, or dead skin cells. Or the eschar can build up on the wound as a thin layer. When we do have our burn wounds, and we treat them with any type of topical agents or so, sometimes a thin layer of dead skin cells or drainage, exudate builds up on the wound, and we would like to get that cleaned off when we do their dressing changes or their tubbing procedures. Looking at the main sources that can result in the burn injury, there's 4 different types. We have thermal, scald, chemical, and electrical. Now, some areas do classify thermal and scald together. For this module, I've separated them out because they're quite a bit different on who we see with those patients that get these injuries and how they're treated. In the modules that follow this one, there will be more in-depth discussion about these 4 types of injuries and what we do for them with treatment. When you talk about a thermal injury, it is the most common cause of burn injury. It results from exposure to heat, any type of contact, fire, and flame. So a good example is maybe a child playing with matches and they catch their clothing on fire. When you look at a thermal injury, a lot of times you're not just going to have one area that's 2nd degree or partial thickness. You're going to have some areas that have some 3rd degree. There's areas of unburned tissue. Many times you'll see that there's a peeling effect of the dead tissue to that area on initial presentation. With scald injuries, these are caused by any type of hot liquids or steam. The duration of contact and temperature determines the injury. When we look at some of the consistency of liquids, they can cause the burn to be deeper. For example, grease. Since grease is thick and it's heated to a high temperature, these can end up being deep 2nd or 3rd degree burns. With scald injuries, hot water is the most common source. So young children and the elderly are at greatest risk for this type of injury. With our scald injuries, this is just an example of some of the different temperatures of things that are around our house. Like a comfortable infant bath should be about 98 to 100 degrees. A jacuzzi is 103 to 105 degrees. But when we go up and look at 130 degrees, it only takes 30 seconds for a 2nd degree partial thickness burn to occur. When we're talking about 146 degrees, 3 to 4 seconds for 2nd degree partial thickness burn to occur. And then looking at serving temperatures of McDonald's and Starbucks coffees, those are usually 175 to 185 degrees, so you can see the burn injury or scald injury could be very severe. One of the biggest things when you talk about scald injuries from hot water, those are 100% preventable. Many times we need to look at our hot water heaters and see what settings they are set at. Well, we suggest you set them at 120 degrees. That's the lower level for those hot water temperatures. When you're set at 140 degrees, that's the medium setting, and it only takes about 3 seconds for a 3rd degree burn to occur with that tank set at that amount. Chemical injuries, they result from acids, alkalines, and organic compounds. When you look at chemical injuries, many times the chemical can be absorbed through the skin. Maybe if someone that was in household cleaners, they may drink something, so that can be absorbed through the mucous membranes, ingested, or there can be vapor from that and they can be inhaled. When you talk about treatment for chemical injuries, one of the biggest things is you want to remove the clothing. If it's a dry chemical, brush off that chemical first and flush the area with copious amounts of water. Now, one of the things that you do not want to do with any type of chemical is give an agent that neutralizes that chemical, because it causes a heat reaction and that can cause the burn wound to be a lot deeper. One of the things we do say, if there are any blisters that form, you would want to break those blisters open, because that harbors the chemical underneath, and make sure you flush that area well. With chemical injuries, you do want to identify that chemical, and with all burn injuries, you want to make sure that you protect yourselves before you touch that patient. So you want to make sure you have on your protective equipment like gloves and masks, etc. With chemical injury, the duration of contact and type of chemical can lead to deeper injuries. And many times the skin can look a little bit discolored, but the injury can be more severe than what you're looking at. So just make sure, if it is a chemical and you do have some discolored skin area, that you flush that area too, and make sure you assess that area after that patient has flushed and when they're more stable. Electrical injuries is another type of burn injuries, and these result from exposure to an electrical current. When you talk about electrical current, electricity takes the path of least resistance. So if I'm standing and I touch something with my hand, it's going to come into my hand and then it'll go out my feet. It wants to ground itself. If I'm kneeling, it would go out my knees. There's two basic forms of current. There's direct current and alternating current. Direct current only flows in one direction, where alternating current reverses direction of flow at regular intervals. When you talk about electrical injury, it can cause a technic muscle contracture, where the person can be frozen to that source. So if you're ever a first responder with a person that has an electrical injury, you want to make sure that that electric current is off to that patient before you touch that patient, or else you're going to end up completing that circus and you're going to end up with an electrical injury too. When we look at what determines the damage from electrical injury, it's based on the intensity of the voltage, the route the current passed through the body, the duration of contact, the victim's state of health, and the speed and adequacy of treatment. Many times with electrical injuries, they can cross the heart at its resting stage and will stop that heart. They can also cause cardiac arrhythmias. Electrical injury damage results, like we said, from cardiac rhythm disturbances. You can have a flash, contact, or you can also have a thermal injury. Maybe your clothing catches on fire. You can end up with deep, full-thickness burns, compartment syndrome, associated injuries, and also sudden death. When we talk about electrical injuries, you can have contact points, and that's where the electricity maybe entered or exited the body. You're going to have most damage in that area, but there's a lot of damage to the areas that you cannot see, because the electricity passes through the body as it goes through bones, muscles, etc. Energy will pick up and it results in more damage. One of the things with electrical injuries is there can be compartment syndrome. And what this results from is high tissue fluid pressure in an enclosed compartment. What happens is you have your muscle, and it's enclosed in a fiber sheath, or the fascia. As the current passes through the muscles start to swell up. That fascia does not give at all, so the muscles clamp down on the veins and arteries, and that's where you get the term compartment syndrome. So that edema compromises the circulation and it reduces capillary perfusion. Signs of compartment syndrome are the 5 Ps. You're going to have increased pain, decreased pulses, pallor to the area, paresthesia, and paralysis. One of the main things that needs to be done is a fasciotomy, and that will release the pressure. Now, a fasciotomy is done in surgery. They will go in, and of course, they will cut down through the skin area, through that fascia, and then that muscle will kind of release that pressure on those veins and arteries. Now, to make sure that area from the fasciotomy heals up, mainly you're going to have to put a skin graft to that area. Damage also can result in release of red blood cells from your tissues and the muscles. What happens is as the electricity goes through the body, red blood cells are released. And these red blood cells go right to the kidneys and they can clump up where the renal tubules are. So it's myoglobin that's released from the muscles, and you have a state what's called myoglobinuria. And that can lead to acute renal failure. With electrical injuries, what we do need to do is we need to make sure that the victim has enough fluids. So we're going to gauge that by looking at urine output. For an adult, we want at least 75 to 100 cc's of urine out an hour. For a little child, we would want 2 cc's per kilo per hour for that child to make sure that urine is flushed. So in summary, we look at the skin, and it's our largest organ of the body. When the barrier is disrupted, it can cause direct problems, not only for that skin area, but for the entire body. When we look at burn injury, we classify them by depth, extent, and type of injury. And of course, your treatment depends on the assessment of the burn depth and the extent of that injury. These are our references that we used, and that's it for this module.